Hello dear students, welcome back to my channel, I Love Pharmacology. In today's session, let us learn about anti-H. pylori regimen, which is very important. So under anti-H. pylori regimen, you have got triple therapy, which will consist of 3 drugs. Second, quadruple therapy, which will consist of 4 drugs. And a sequential therapy, where you will be administering 2 drugs followed by 3 drugs. So these are very popular regimens, that is triple therapy, quadruple therapy and sequential therapy. So first we'll take up the triple therapy. So the name itself suggests that triple means you are using a 3 drugs in combination. Please remember, triple therapy means you are using a 3 drugs in combination for 14 days. For 14 days. So what are those 3 drugs? So the 3 drugs are, first you need to remember that out of 3 drugs, 1 drug will be from the proton pump inhibitor. So here the proton pump inhibitor is the omeprazole or lansoprazole. So which is administered in the dose of 20 milligram omeprazole, or if you are using lansoprazole, the dose will be 30 milligram BD. So along with one proton pump inhibitor, you will be using the other 2 antimicrobial agents. So here you have a clarithromycin 500 milligram BD and amoxicillin 1 gram BD. So if the patient is allergic to penicillin, so that in place of amoxicillin, you can go for metronidazole or tinidazole 500 milligram. So apart from this regimen under triple therapy, there is one more regimen under triple therapy. So instead of using omeprazole or lansoprazole, which are the proton pump inhibitor, in place of those proton pump inhibitor, you can use ranitidine. You can use ranitidine bismuth citrate 400 milligram BD, followed by there will be 2 antimicrobial agents. So here you can see tetracycline 500 milligram BD and metronidazole 500 milligram BD, or I can combine with the clarithromycin. So this was about the triple therapy, which is used for H. pylori eradication. So next, moving on to the quadruple therapy. This quadruple therapy is also administered for 14 days, similar to that of the triple therapy. So here you can see that quadruple means you are using 4 drugs in combination. So out of 4 drugs, 1 drug will be the proton pump inhibitor. So here again you can remember omeprazole or lansoprazole. The dose is 20 milligram or 30 milligram if you are using the lansoprazole. And this has to be given. This has to be given OD. Whereas other drugs under quadruple therapy includes bismuth subsalicylate. Here 2 tablets of bismuth subsalicylate is used, which will consist of 525 milligram, that is 4 times a day. Along with that, there will be metronidazole 250 milligram 4 times daily and tetracycline 500 milligram 4 times daily. So this is about the quadruple therapy. So next, moving on to the sequential therapy. Here the sequential therapy is given for the duration of 10 days. Please remember, here there are 2 phases. In the initial phase, which includes from day 1 to day 5, you will be administering the two drugs. You will be administering two drugs. So these are the two drugs. So this is one drug and second one is the antimicrobial agents. So one drug you will choose from the proton pump inhibitors. Please remember, in the initial phase for the first 5 days you will be choosing two drugs. So out of the two drugs, one drug will be from proton pump inhibitor, either the omeprazole or the lansoprazole. Along with that, you will be adding amoxicillin 1 gram BD. So after 5 days, from day 6 to day 10, so you will be using three drug combination. Please remember, you will be using three drug combination. So this will be the one drug, this will be the second drug, and this will be the third drug. So here you can see clearly that you will be adding omeprazole or lansoprazole. Along with that, you will be adding clarithromycin 500 mg BD and tinidazole 500 mg BD. So this was about the sequential therapy. Next, moving on to the summary. So triple therapy means you will be using three drugs in combination. Most commonly, you will be having, out of three drugs, one group of drug will be from proton pump inhibitor and other two drugs will be from the antimicrobial agents. So here proton pump inhibitor can be of omeprazole 20 mg or lansoprazole 30 mg BD. This is combined along with clarithromycin 500 mg BD or amoxicillin 1 gram BD. If the patient is allergic to penicillin, you can replace amoxicillin with the metronidazole 500 mg, or in place of metronidazole you can use tinidazole. So apart from that, there is one more triple therapy where you can replace the proton pump inhibitors with the H2 blocker, that is ranitidine bismuth citrate 400 mg BD. Along with that, you will be adding tetracycline 500 mg BD, metronidazole 500 mg BD, or you can add clarithromycin 500 mg BD. Whereas, so all this triple therapy is given for, please remember, it is provided for 14 days. Whereas in case of quadruple therapy, again quadruple therapy is administered for a total duration of 14 days. So here you will be using four drugs in combination. First is the omeprazole or the lansoprazole, which are the proton pump inhibitor. Along with that, you will be adding other three drugs like bismuth subsalicylate, metronidazole, and tetracycline. Whereas in case of sequential therapy, which is provided for 10 days, for the initial 5 days, so you'll be adding two drugs, that is one from the proton pump inhibitor and other from the antimicrobial agents. So here you will be using omeprazole or lansoprazole plus amoxicillin. So after 5 days, from day 6 to day 10, you will be adding three drugs. So here one group of drug will be omeprazole or lansoprazole, and second group will be clarithromycin, and third will be tinidazole. So following the completion of all these therapy regimens, the individual needs to continue the proton pump inhibitor once daily for another 4 to 6 weeks. This another 4 to 6 weeks treatment of proton pump inhibitor once daily is to ensure or to promote the ulcer healing. Thereby, the patient will not go for relapse. So this was about the anti-H. pylori regimen. If you like this video, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.